Yeah, we, yes. So this is what is known as, or this is the area of interest for us homeopaths to bring the homeostasis back to the normalcy. So homeostasis. Vital force tries to maintain the homeostasis in whatever situation. Whatever the hostile situation is, if our vital force is in perfect harmony, vital force contains body, mind, and spirit. Dr. Samuel Hahnemann has said this. And everywhere nowadays, no, it is all the talking about the body, mind, and spirit is the fashion nowadays. In every group, they will have some intellectual group or some philosophical group or some Bhagavad Gita group or some religious study group, and everywhere man is trying. Why man is trying? Why other animals are not trying? Why plants are not trying? Because man is the most evolved of evolved and evolved, the most evolved of all the living beings in the evolution. From the man, from the amoeba, sorry, from the plant, from the amoeba, from the plant, from the unicellular to the multicellular, and through the various phyla, we have all emerged into chordate, vertebrate, Homo sapiens, and beyond man, there is nothing as of now. Maybe a superman can come on, and we are all part and parcel of that. And we are producing super kids now, all multi-talented and all child prodigies. Because the zamana, the kal, or whatever, the era is going towards a super or multitasking, and all the AI has come in, and with the efficiency, so much of efficiency. We are all doing multitasking nowadays, no? We were all used to have only one task at a time. Now we are all putting all these airports and all and doing something else, and everything we are all able to do, no? So much of jobs. So we are all kind of superhumans. And what about the next generation? And then the next generation, they are born super kids. So the evolution of man is also going on, and everywhere unrest is there because of the hostile world. And what is man trying to do? He is constantly trying to do the inner peace. He is running behind the inner peace. Where is the solace? We are earning money, we have all the comforts, and here is where Sadhguru has talked about the inner engineering. No, we all have heard about that. Why all these so-called gurus are coming up now? Because it is very much needed for our peace of mind. Because no, everybody are achieving everything. There is no shortage of money or the food and clothing or shelter nowadays. But what is in shortage? Peace of mind is in shortage. The love and relationship and the values are in shortage. And we feel that girth, we feel that vacuum inside us. We want to fill that vacuum. Even if we have achieved everything, we feel that lacuna inside us. And this is the reason for the suicide of the achievers, the so-called achievers. We think that why are they committing suicide? They are the number one. And why are they committing suicide? Recently, or some 2 years back, one Popo, that he has won 6 or 7 Olympic medals in one competition of swimming. In all the swimming competitions, in breaststroke, in backstroke, in everything, all synchronized thing, everything, he has been the gold medal. He has won the gold medal, and now he has committed suicide. Can you imagine? So at this young age, he has come to the topmost of the world, and what more does he want to achieve? But he has felt the lacuna inside him, and he committed a suicide. How sad is it? So which means what? The outside achievements and everything are not giving us the inner solace. So man is always behind the inner solace, the inner peace. So when our vital force is in perfect harmony, we are able to use this perfect harmony, or use this energy from the vital force to achieve more and more, or what to say, to do our higher purpose of our existence, as Samuel Hahnemann has said. So what is our purpose of living? Why did we born in this earth? Why did we take birth in this earth? There will be some meaning for that which we don't know. Why did we take birth as a particular religion? Why did I born to my parents? There is no answer for all those things. Maybe we will take use of the other things, no, like the Vedanta, and we will start talking about the karma and all that. We are choosing our parents, the couples, father and mother, and they are praying for a kid, and we are born for them to complete their life, the karma. And now we are marrying, and now we are producing kids, and this is going on and on and on. Why are we producing such kind of kids? All these things are according to the karma. We don't want to drag in the Vedanta here. But then, yeah, while we were talking about the vital force and why we were talking about how to make use of the vital force for our higher purpose of existence. So when this purpose, when you know what is the purpose of your life, then and only then you will be in 100% harmony. You will be in 100% peace. When you know that, okay, this is my space, this is my place, this is for what I have born. And by doing this job, I am getting so much of comfort. I am getting so much of satisfaction. Then you know, then you feel that you are complete. Then you feel the satisfaction that you are saturated. And there is no more to achieve.
Yes,
Because if you start achieving, what happens? Again, you will want to achieve. You got only 6 Olympic gold medals. How sad. I want to have 7th gold medal. I want to have 8th gold medal. I want to have 10th gold medal. Is there any end to this greed, or is there any end to this achievement? The seeking for achievement? There is no end to this, guys. So what is the purpose of living? Okay, I have achieved this much, or whatever job I am into, and this is my job, and serving others and giving something back to the nature will keep you complete, or that lacuna will not be there. So this is the only reason. Give me 1 second, guys. So that is Darwin's theory, that is survival of the fittest. And then our immune system, animating force, which we call the vital force, the maintaining of the homeostasis. That is where we are. A dent in this immune system produces what is called disease. When our immunity is flowing through us in 100% harmony, no disease can attack us. Even if you lie down and sleep with a chickenpox patient or with a herpes patient, it is not going to attack us. Previously, mothers used to do this technique. When somebody in the child falls sick with chickenpox, you know, viral disease, it will just spread like that. So these mothers will bring all the neighboring kids, because you can at that time they consider viral disease as a blessing from the Amman. That means from the goddess. It is a blessing from the goddess. So what they will do, they will call all the same age group friends, neighbors, neighbor children to play with in one room. There is no isolation and all at that time. So they will allow the children to play, so that 14 days of suffering and all will not be understood by this child also. That suffering will not be there. The suffering will be allayed because he and his friends are all there. And one after the other, every child will fall sick. But then there will be, fall sick means what? It is a welcome thing. Chickenpox is coming and that immunity is gained. After the chickenpox, the child will grow better. The child will ask for more food. And then the child has crossed one stage of life and he has jumped into the next higher level. This is how the viral diseases are considered at that time. And now Vijayakar sir says the same thing in a different way. That is, all these viral diseases are nothing but the discarding of the DNA or the RNA from our own body. Our own body is made up of genes, that is RNAs and DNAs. And all these things, there will be a lot of free radicals in our body. There will be a lot of, due to some emotions or suppressed emotions or even expressed emotions, there will be a lot of breakage of RNAs and DNAs. These are getting accumulated in our body. And when the right time comes, this will be thrown out of the body in the form of any viral disease. And this is self-curing. You don't have to treat with medicine. All the viral diseases can be just left like that. You just have to supplement, or you just have to monitor the patient, whether it is all going in the what direction. Tell me. In what direction will the chicken pox and the viral diseases go? According to Herring's law, or opposite to Herring's law? Why? Because this is not a disease. This is not a disease. So should it go from center to periphery or from periphery to center? It is just like according to our growth gradient, according to the what gradient? Nutritional gradient. It is coming first, it is coming at the center itself, no? And it is disappearing from the center to periphery. It is not going in the reverse direction. In whatever direction it has come out, it is disappearing in that same direction. It is not going in the reverse order of appearance. Chickenpox relations, first it comes on the trunk. and later on it comes on the extremities, whereas an eczema or a psoriasis or a disease, skin disease will come first upon the extremities, and then it will slowly spread towards the body. So first, our weakest portions, the distal part of the vital force only will be affected by the disease. Whereas the genes, when it is thrown out, it will attack, it will from the spine, from the central nervous system, it is thrown out. So the disease is coming in the center to periphery direction in all viral diseases, and all viral diseases heal in the same way from center to periphery. Yeah. So this is it. It's not in the reverse order. So this viral diseases are considered as a natural elimination of the toxins from our body. So it is a welcome sign. And these mothers will make other children to lie down with this sick child, sick with chicken pox or any other herpes infections. 70% of the children will fall sick, but there are still the 30% of children who will not contract the chicken pox. Why? Why? 100% according to the theory, this virus should attack all the remaining 30% children also, no? Why only some of the children are getting infection and some are not getting infection? So this is purely based upon the immunity, the so-called immunity. There are no free radicals for this child. This child is complete. In its protein alignment, it is totally complete. There are no bad emotions for this child. And hence, the gateways of this child are so strong that it did not open the gateway towards the virus. What is the virus after all? The DNA. There is nothing to throw out. This child is complete and happy, and there is no infection. So this is the harmony of the vital force in both, in the triad of mind, body, and spirit. So whenever there is a dent in the immune system, only when there is a dent in the immune system, a disease comes in. When there is no dent in the immune system, there is no disease. Yes. Thus, disease is nothing but the disturbed homeostasis and failure of the immune system to cope fully with the disturbing force. Whenever there is any disturbing force, if you are equipped to cope well, with the disturbing force, you will not fall into sickness. This is how the psychosis works. In the psychotic miasm, we are all taught to be positive, take things in the positive way. Yeah, don't succumb into the negative things or ignore the negative things. Take only the positive things. Count the blessings. Be sympathetic to others. So even if they shout at us, we will not feel like shouting back at them. So we will be rather not reacting, or we will not allow our protein alignment to get lost. If our protein alignment is perfect, we will not get any free radicals. We will not get any diseases. So likewise in the psychosis we are learning though, every time we are learning. So in the psychosis we know how to manipulate in the healthy way, and how to don't give heed to whatever which is bad to you. You know that it is bad. Okay, so keep away from that for your safety, and those things which are good, you are open to that. No, so that's why we say that no, don't open the TV, and always some or the other debate will be going on that is totally negative, and that bad energy will attack you. You also will be having palpitations and all sorts of adrenaline rush after hearing the bad debate. So just shut down the TV. No, it's not good to read the newspapers nowadays. No. So whenever our immune system is flowing on and on without any dent, our health will be very good, 100%. That's it. The protective or defensive forces use all their energies to keep the disturbing forces at bay. So whatever disturbing forces they are, our protective force should be stronger. Then you will be able to keep the disturbing forces at bay. If they are not entirely successful, either due to its own lowered vitality or due to the overwhelming disturbing force, then they may allow the dysfunction to start with, followed by structural changes of organs or tissues or systems which are of lesser importance, thereby trying to keep the more important parts as much healthy as possible. What does this mean, doctors? So, due to two reasons, when do we fall sick? Either our vitality is low or the hostile force is strong. These are the two reasons. If the hostile force is very strong or our vitality is little low, these are the two reasons when we fall sick. And how does the sickness attack? In the first instance itself, it will not come as a cancer or the deadly disease. It will first affect our functions, later on the structures. This is called that. They may allow the dysfunction to start with. That means functional disturbances will happen initially, followed by structural changes of organs or tissues or systems, which are of lesser importance. Initially, the lesser important systems. Which are the lesser important systems? The ectodermal derived tissues are all lesser important systems. And there can be functional changes. There can be rhinitis, or there can be little bit of bronchial asthma, etc. Immediately, it is not going into interstitial lung disease, where the structural changes have happened, or it will not go into a tumor or apical tumor of the lung. It is the structural changes are not happening now, or emphysema or COPD. All these things are coming. The structural things are getting affected only later on. So initially only functional disturbances will be there. That also on the lesser important organs or tissues or systems, thereby trying to keep the more important parts as much healthy as possible. So this is how our defense mechanism works. Are you all with me, dears? Just give me a hand. Some indications. I'm not boring you now with too much of explanation. Good going? Okay, dears. Okay, dears. Thank you. Thank you. Thank you. Okay. Thus, as our defenses fail, layer by layer or system by system, the disease symptoms start manifesting themselves in deeper and deeper organs or system. This is how it is. When our defenses fail, when our immunity is so low, then the disease is happily attacking us layer by layer. First, the ectodermal disease. This is why we go into the journey of the disease. At what age? Journey of the disease. What was the first disease? What was your past history? What was your childhood diseases? So, journey of the disease. First, it was a skin disease, that is ectodermal disease. And then it has come into the endoderm, and then into the mesoderm, etc., etc., etc. It has come into this level now. And initially it was only functional disturbance, and now it is the structural disturbance. This is how we come into this patient. Every patient will have his own story. Next, we come to the important question of how do we decide which organ or system is more important than the other. We have already dealt with this, no? Now we are all thorough with which organ is lesser important, which organ is more important. Yes, the direction which the disease will take, and conversely, the direction the cure should take in any particular individual. So what is the direction of the disease? The disease will be coming below upwards, and the cure should happen above downwards. Yes. How do we judge whether after the removal of the symptoms, the patient is on the right path or not? All the symptoms are removed. Now, how do we know whether the patient is improving or not? By looking into the next symptom, no? When the next symptom is of a lesser important layer, or a lesser important organ, or a lesser in miasm, then we know this patient is going on in the right direction of cure. Or if the next symptom is cheating us, if it is going above, if it is going to the next higher miasm, or if it is going to the next higher layer, or if it is going much deeper, then you know that your prescription is wrong, even though there are no symptoms. Yeah. So these are the good inputs given by Dr. Vijay Kai. The importance of the organs and systems can be known from the knowledge of embryology and physiology. That's what we have talked about now. The next paragraph. Journey of disease can take place either as a result of the unrestricted natural progression of the disease, or due to suppressive means of any kind. Two things. Either our immunity is zero, and the disease is attacking us. It was the ectoderm. Our body was so weak that it did not give any defense. So it easily went into the endoderm. There also our body did not give any defense. Then it went to the mesoderm, third layer. Our body did not give any defense. It went into the fourth layer. Organs were affected. And then it went to the fifth layer. Then it went to the sixth layer, that is the neural layer. And then it went into the seventh layer, where the patient is down with Parkinson's or with schizophrenia or anything. Why? Our defenses, various gateways which our body has provided with in the lower layers, were inefficient. they were inefficient. So that is the reason why the disease progressed happily from the first layer to the seventh layer. Another example, it need not go all these layer to layer, layer to layer. If the immunity is zero, what will happen? From the first layer, crossing the neuroectoderm, it will go straight into the sixth layer or even into the seventh layer. Yes. So that is if the immunity is zero. This is one thing. And the other thing is, when the diseases are treated, okay, we have taken help from the doctors and the doctors had given us some antibiotics or some steroids to suppress. The disease is not gone, but it is only suppression. The symptoms are not there. No symptoms are there and the patient is able to walk, go, run, jog, go to his office, go to his school, everything. But then where is the disease? Is the disease gone? No, the disease is hidden inside. It is not allowed to show. So Montelukast, or the Levolin inhaler, Budicort inhaler daily. How many days you have to take the thing? For 6 months you have to take. What does this mean? What does this mean? It is steroid inhaler. Did the asthma go anywhere? Did the asthma disappear into thin air? No, the asthma is still there. One day, if I don't give the Montelukast tablet, doctor, my child is not able to sleep. What happens? Utter nose block, and the child is struggling to breathe, and there is cough, and the child is not able to sleep. It gets up and it sits up, and then it is coughing, and the child is angry, or it is crying, or I have to carry him, and I am not able to sleep. The entire family homeostasis is gone. Why? Because one Montelukast has been missed that day. What does this mean? This Montelukast or this steroidal inhalation should be given every day for 6 months. And after 6 months, what happens? Maybe because of the stronger power of this tablets, it may that the scenario may run for few months. For 1 month or 2 months, the child was okay. After that, how much this drama will go without the own immunity? How much time a wig can remain in your head? Huh? Our own hair is not staying in our head, and then how the artificial hair will stay. Just like that, our own immunity is not supporting, then how much the artificial immunity, the so-called suppression, will stay. When the suppression is removed or when the steroidal inhalation is removed, immediately the disease is coming back again. And then the mothers realize, okay, this is not the right method to treat. I don't want my child to be put under such strong medicines. The mother realizes that, and then they come into natural systems of medicines like homeopathy. So these are the two things. Either there is zero immunity or there is suppression. And when it is suppressed, what happens? The endodermal disease is gone now because of the continuous usage and bombarding of the Montelukast or the Budicort inhaler. So then it goes into the, okay, there is no sneezing at all after that, but the sugar levels can be high or the BP level of the child can be high. So this is the traveling of the disease from layer to layer. Either the disease is stronger, that's why it jumps from layer to layer, or because of the suppression, the disease leaves that level and it goes to the next higher level. Are you all with me? Give me some indication, some hand raise or something. You are getting the points. So now the types of suppression. Yeah, thank you, Dr. Kylie. Hope everyone understood. Yeah. Thank you, guys. Thank you. So now this suppression. Now we were talking about the suppression. Suppression can be of any kind. So this can take place in 5 ways, 5 methods. The suppressions are of 5 methods. One is location to location. That means in the same organ. Eczema or vitiligo spots on the lower limb getting better and appearing on the upper limb. Okay. So what is this? Eczema or the vitiligo spots getting on the lower limb. Yeah, we have an eczema on the lower limb, and after giving a medicine or after giving some topical application or after giving homeopathic medicine or after giving any antifungal or any some atopic dermatitis, some ointment will be given. For itching, Allegra will be given. What will happen? That itching will immediately disappear and the new itching will come at other areas of the body little above. That is the typical example of suppression in the same layer. That is location to location suppression. Now, next thing is organ to organ in the same system. For example, nasopharynx. So nasopharynx is endodermal, right? You inhale and then the nasopharynx is the posterior nares. From nasopharynx, after taking the Montelukast or the inhaler or even sometimes homeopathic medicine, unfortunately, it goes into the larynx. That is, it is little deeper. That is pharyngitis to laryngitis to bronchitis. That is all endoderm, right? Pharyngitis, laryngitis, bronchitis in the same system. Which is the system? Respiratory system. Respiratory system, pharynx to larynx to bronchus. Another example, aphthay on the tip of the tongue disappear after the remedy, only to appear posteriorly on the fauces. Mouth, yeah, tongue, and then the fauces. Again in the organ to organ, in the same system. Then pain in the neck due to cervical spondylitis disappears to give rise to hoarseness. That is the inflammation on the cervical cartilage gets transferred into inflammation on the vocal cords from back to front. That's all. Cervical cartilage and then the voice, that is again a cartilage, and voice box, the larynx is again a cartilage. So this is also just like shuttlecock only, from there to here and from here to there. So what is this? This is frank suppression, which means here the immunity of the immunity is not better. The vital force is not strengthened with our medicines. Then the third suppression is system to system. See how calculatively, how nicely sir is giving us, decoding this and giving to us for us to apply. System to system in the same layer. Bronchitis getting better and diarrhea or urinary tract infection develops. So what are the systems in the second layer? What is the second layer? Endoderm. Sai Narendra is giving something. Body sprays. After scent. Can it suppress all the time? In which disease we can avoid, madam? Yeah. Sai Narendra. So all these body sprays and attar and the perfumes, the scent and all, especially for skin diseases. What are these body sprays doing? I'm answering to this question, right, guys? What are these perfumes doing? What are these deodorants doing? What are these talcum powders doing? They are closing the natural pores of the skin. Our skin is having natural pores. Skin is the greatest excretory organ. According to the SORA, according to the psychosis, according to the syphilis, according to the age, the skin as an excretory organ behaves in different ways. In the soric phase means for children. Children are generally considered as soric until the age of 10 or 12 before they become adults or before they come into the puberty level. They are children, both of them, boys or girls, they are alike. Yes, their hormones are not yet developed. So the sexual identity is not there for them. They can sleep together, they can play together, they can wear any kind of dress, no questions. So, and their voice also will be alike, no? Boy's voice is also like a girl's voice only at that time. Children, they are soric. That is unconditional love. There is no judgment at all. The most beautiful days of anybody. We all have a child in ourselves, no? So how will the skin as an excretory organ behave in the soric stage of life? In the form of small rashes, in the form of vesicular sudamina, that is the heat boils. Yeah, heat boils, verkuru. In Tamil, we will say it as verkuru. Due to the sweat, we will get some eruptions. All this, some small eruption. We all had that. Yeah, tell me, we all had that. Yeah, some. When you come into the adolescent stage, slowly you are coming into the psychotic miasm, where you are planning for the reproductive hormones are coming in now. The sexual identity hormones are coming in now. And the girl gets matured and the boys, that Adam's apple develops and his voice is thrown like a big man's voice. And then other functions, sexual functions are happening. Why? That is in the aim of reproduction. What is reproduction? What miasm is it? That is psychosis miasm. So from the adolescent age, the psychotic miasm starts. And how will the skin as an excretory organ behave in the psychotic miasm? Yeah, we all had, no? Acne, acne rosacea, acne vulgaris, the sebum, that means the secretion of the sebaceous gland, that is more, and oily skin. And we are worried about that. One pimple coming because we are worried about the beauty. We want to attract, no? That is how nature is. There is nothing wrong in that. If you don't have all these worries, believe me, you are something deficient. You don't have some functioning. You are kind of indifferent, or something is there that has to be addressed. That has to be addressed. So when you have to be shown up, you have to show up. There is nothing to be to be ashamed of that. Yeah. So the acne comes in, all the pimples comes in, then hidradenitis suppurativa, all those things can come up at that time, okay, upon the skin in the form of excretions. And here comes the question. When you do the body spray, at this age only, you will start using the body spray or over makeup or over lipstick or over foundation on the face or scent and attar and all. What will happen? The natural pores of the skin will get blocked, and then the sebaceous glands or the sweat glands are closed, or even the Z's gland of the eye, they are getting closed. And what will happen? All the secretions will remain inside, and then they will be getting collected, and they will form what? Either they can form a sebaceous cyst, or they can form big acne. Because of the hormones also it can develop, and because of the natural obstruction of the pores also it can develop. All the dirt and all will remain there, and then it will pop up on one day. And uh, what thing else? So the natural pores of the skin should not be closed. It should be kept open. So this is the reason why we say that all these body sprays and things are all not good. So if there is offensiveness of the body, that bad bacteria is too much, or maybe the sweat is smelling bad, and if you're conscious about that when you're sitting close and all, so you can use all these body sprays where? Upon the dress, upon the cloth, not on the skin. Okay. So, we have to, Sai Narendra was asking some question. I wanted to. Yeah. In which disease we can avoid them? In any disease, Sai Narendra, get me right? In any disease, your advice will be not to put any deodorant in the, as if in the advertisement, how they will show. Directly applying on the skin. No, that is not advisable. If you want, you can do the spray upon the clothes. That is the answer for all diseases. Then Arya Devi rightly said that all these things are suppressions. Archana is giving some inputs. These things increase the electrical potential and pushes the toxins to deeper organs. Wow. Thank you so much, Archana. These are all also, it is suppression, no? It is pushing the toxins to the deeper organs. See how beautifully she has said that. Because the toxins are getting collected. The toxins, the natural pores are closed. The natural discharge is not happening. And with the bath, everything is gone, but that is not happening now. So it is pushed, it is not allowed to show up, and it is pushed into the deeper organs. Thank you, guys. Where were we? System to system. Yeah. So what are the systems in the second layer? Second layer is endoderm. In the endoderm, we have three systems. That is the respiratory system, the lesser important. After that comes the GI tract. That is the more important. And then comes the GUT, that is the most important. So this is the gradation in the second layer. In the endoderm, it's a system to system in different layers. So that is in different layer means here we are dealing with endodermal layer. The example is given. Gastro in the third point, system to system in the same layer. Now we are dealing with the endodermal layer. Example, bronchitis getting better and diarrhea comes in. So it is suppression. And after that comes the urinary tract infection. Believe me, you will think that this urinary tract infection is very easy to cure, no? Anybody would have treated that with a dose of Cantharis. Yes, we all have tried Cantharis, no? And we all have tried Apis mellifica, pulsatilla, staphysagria, clematis, according to the end of micturition, according to the beginning of micturition, etc. Berberis vulgaris, all this terebinthina, all this skin, all these urinary tract infection remedies, we all have given, right? And we all have cured also. Then how did it got cured? Because it was the psoric miasm. When you come into the later stages, later ages, okay, we got that stopped in between. Sorry. We were talking about the skin as an excretion. How will it show in the syphilitic form? That means we have talked about the psoric, we have talked about the psychotic, and what age group will be the syphilitic age group? That will be from the age of 40, maybe after 40. After the age of 40 till death, it is syphilitic. roughly speaking, okay? So the adolescence will be there. The reproductive period is a long period. That is from the 12 or 13 age up to the 40th age, or the even up to the 50th age is the reproductive period, no? And after that comes the, or the syphilis also gets slowly added on after the age of 40, 45. And nowadays, it is all coming early also. Then how skin as an excretory organ, how will it show in the syphilitic people? It can come in the form of ugly warts. Verrucae, that is psychosis, yes. But then if it is ugly, yeah, if it is bleeding, if it is painful, yeah, and then horny, and then it will be like cauliflower growth. All these things are unwanted things, or pediculated ones. All these things are coming up sometimes in the upper part of the thigh, there where the ladies will not be able to walk because this thing is getting in between. And or sometimes it can be at certain parts, the fleshy parts, there it will be like hanging down in the form of a big thing. All these things are psychosyphilitic. Syphilis is also joining their hands. So that is, all these things are skin tags. We generally say, no, these are skin tags, nothing can be done. And big warts, how much Tuja, Sabina can you give and make all these warts go away from the body? Why is it not going? Because of so much of collections from the psychosis, all the toxins are there, and it is slowly pushed out, and now it is pedunculated, and it is moving this side, that side, and it is becoming more and more ugly. The more and more uglier your thought processes are, the more and more anger and revenge and hatred you have, this thing also gets more and more uglier. Where more syphilitic means more uglier it is. And who is suffering? You are the only person who is suffering. That is why we say the Kama, Krodha, Moha, Lobha, Mada, Matsarya, all the Shadvairigal, you have to throw out for your goodness, for keeping your homeostasis, for keeping your vital force clean. Then there will be, the excretion will be much lesser. Why? The waste products you produce is much lesser, and the toxins you produce are much lesser. The free radicals you produce are much lesser. Your reactions will be purified. Your reactions will be rather not there, only responses will be there. How to respond, in a good way or in a bad way, that is utterly your choice. So now coming to the fourth point, that is the system to system in different layers. Example, are you all with me, guys? System to system. That is gastrointestinal complaints. Yes, that is the endodermal disease, like diarrhea, getting better, and patient developing hair fall. Yes, the best example is typhoid, gastroenteritis. And after typhoid fever is fully over, the patient starts losing hair like anything in handfuls. So this is the jumping of the layer. From the endoderm, it has gone into the third layer. Third layer is the mesodermal layer. It has gone more deeper. Diarrhea getting better and patient developing hair fall or arthritis. Hair fall is dermis. Hair fall is not the ectoderm. Hair fall is the dermis. Dermis, that is the hair follicles. The hair follicles are embedded in the dermis. So if there is lot of hair fall, you can always think that this is a suppression. What had happened before this? Then the patient will say, I was having a typhoid, or I was having a gastroenteritis, or some diarrhea, some diarrhea dysentery. And I took some medicines for that. It was a bad diarrhea. It was a profuse diarrhea, and maybe some 20 times diarrhea. And I was admitted in the hospital, and they had given me drips. After that, you are developing the hair fall. So it is frank suppression. When toxins go from typhoid to hair fall, we need to probe anger and identity issues as well. Very good. Very good. Yes, Sai Narendra. Why did the suppression start? Okay, because of some allopathic medicine, the disease was not allowed to show in the second layer. Because of the strong antibiotics, it was stuffed inside. And where did it go? It can go to anywhere, no? It can go to dermis, it can go to dermatome, myotome, and sclerotome. So any of these. Why did it choose? Why did it choose head? Or why did it choose scalp? Or rather, why did it choose dermis? Yeah. So exactly, Sai Narendra. Some connectivity problem in the home. Dermis is nothing but part of the skin, no? It is the dermatome. Dermatome means it is part of the skin. Dermatologist is the skin physician, no? So similarly, skin means what? The toxins to eliminate toxins. What are the functions of skin? Like connectivity, relationship, keeping the protection, etc. No, so that thing is affected, and that is the reason why the disease, when it is unable to show in the second layer, poor thing, it has gone into deeper into the dermis layer. So you can always ask about the connectivity problem. What had happened in your family or in your with the boss or with your father? Why are you losing hair? Good explanation, Sai Narendra. Identity issues. Where did you lose your identity? And were you angry? Or maybe the expression will be anger. Sometimes the anger will not be expressed, it will be suppressed. Anyway, this is an angry constitution. Angry plus timidity, they will not express. Or angry and manipulative, they will not express. But all the anger will be inside. And this is the reason why you get the typhoid. And when that is suppressed, it has gone straight away into the dermis means, or into the scalp as hair fall means, you had identity issues, or you had some conflict with your boss, with your father, with your father-in-law, with your teacher, with the head of the institution or head of the family. Thank you, Sai Narendra. Adira is giving some inputs. Wheezing is cured, but dandruff is coming. It is a wrong sign. Yes. Wheezing is cured. Wheezing is in the second layer, that is the endodermal layer. And what is dandruff? That is excessive scaling. The normal scaling, what is the normal scaling then? In the dry weather, we all have. When we simply rub our skin, we get a white line there, white patch there. Similarly, in the scalp, the layer is thick, no? Since it is more thicker, more scaling also will be there, and in the form of dust you can see all those things. That cannot be considered as disease. It is only dryness, and that you will have to apply the proper oil and all the proper personal hygiene you have to take. It cannot be considered as a disease. Whereas if it is real dandruff, and then just by touching, no, Head and Shoulders advertisement, similarly it will be falling everywhere, and flakes will be there everywhere. This person goes there, everywhere all this scaling of the skin will be there. That is not a good thing. Why are you losing so much of skin? It is the precursor of psoriasis, right? There an element of suspicion of psoriasis also comes in, and we always put as a DD, psoriasis. Is it that? So it is the wrong direction. Now, the fourth point again, gastrointestinal complaints, endodermal disease like diarrhea getting better, and patient developing hair fall or arthritis. So what is arthritis now? Arthritis can be anything, no? Like it can be osteoarthritis according to the age. What is osteoarthritis? It is syphilitic or psychosyphilitic. Osteoarthritis will never come for a small child, but a child can still develop arthritis. What arthritis is there? Either it will be a reactive arthritis due to suppression again, or it is a rheumatic arthritis. Now, what is rheumatic arthritis? Bacteria. Rheumatic arthritis, bacteria. Which bacteria? Beta hemolytic streptococcus. Yes. Kyle BD is asking, dandruff is third layer. Yes, dandruff is also coming from the dermis. The scaling is starting from the dermis. So, what to say? Hemolytic streptococcus, and that is leaving the heart alone, and it is coming into the joints. That is migrating major polyarthritis or reactive arthritis in another case, where the child will not be, it will be just like rheumatoid arthritis. What is rheumatoid arthritis? Syphilitic arthritis, coming mostly for adults in old age and all, it will come now, or nowadays it is all coming in younger ages as well. And rheumatoid arthritis is arthritis deformans, where you will get the swan-shaped fingers and all, no, because of the deformity. Yeah. So that is again frank suppression, right? From diarrhea disappearing and arthritis coming up is frank suppression. And further, heart problems, that is the fourth layer. So from the second layer, that is diarrhea, is gone into heart problem. That is second to fourth layer suppression. And then the endocrines getting affected. That is the fifth layer. So system to system in different layers. Yeah, it is jumping systems. It is jumping the layers as well. All these are frank suppressions. Now the fifth layer is, are we ready to go to the fifth layer? Yeah. So miasmatic transfer. That is from one miasm to another. Which are the miasms? Sora to psychosis. A child is suffering from tendency to recurrent bronchitis getting better, only to suffer from hypertension. Recurrent bronchitis, which layer, which miasm? Recurrent bronchitis, which miasm? Bronchitis, Sorek. Yes, bronchitis is Sora. That is getting better only to suffer from hypertension. Hypertension is which miasm? Of course. Hypertension can be any miasm, right? It can be in the beginning, it can be Soric, and then later on, when the structural changes are developed, and then kind of hypertrophy of the heart, and then the atherosclerotic deposits are there, and then chronic hypertension happens. It is difficult to treat, right? Once the structural changes have happened, that is typical psychosis. And of course, but then we know that this is a layer. We don't expect a hypertension kind of disease to come for a child in the soric miasm. We have talked about the age also, no? So we have to match all these things. According to this age, for an age of 12 years or for an age of 15 years, the recurrent bronchitis has been treated and that is disappeared, but then the BP is slowly rising up. Whether it is soric or psychotic or anything, we know that this is not good for this child. Even a soric hypertension is not welcome for a child of 15 years. That's what is meant here. So everywhere you have to apply the mathematics. There is no learning by heart. Just by looking into this sentence, you cannot say that, okay, but then what happens if it is a, yes, anyway, it is a suppression, right? In any miasm, it is suppression. If it is happening to an adult, the chronic bronchitis is gone and then the hypertension is coming up, is it a good sign? No, it is still a bad sign. So that is the miasmatic transfer. Or he is getting a tendency to developing lipomas. Again, lipoma coming here and there are typical psychosis, no? So the recurrent bronchitis is gone and then the patient is developing lipomas, means it is going from SORA to psychosis. Yes, there is no doubt there. The first three types of suppressions are self-explanatory. That is location to location, then organ to organ, and system to system is self-explanatory. We know that is all jumping from system to system and layer to layer. The last two are complex and important. Which are they? That is system to system in different layers and the miasmatic transfer. Little more deeper we will go now. Do we have time? It is already 10:54. Yeah. So I think we will stop for today. So is there any discussion? Is there any quick doubts? Is anybody presenting or is all well? Do you want any improvisations? All suggestions are welcome.
Nobody is there to present, ma'am.
Okay.
So can we discuss in cases?
Yeah, please. Any Sai Narendra is asking. ALS, amyotrophic lateral sclerosis, right? What needs to be probed? Yeah. Amyotrophic lateral sclerosis means what? Myotrophic. Myo means what? Muscles. Lateral sclerosis. Lateral sclerosis means the spinal cord is getting affected and the nerves are getting affected. Here the CNS, that is the central nervous system and the peripheral nervous system. But then the spinal, the spinal thing you have to probe for. The brain is not affected, but then the spine is affected. So sclerosis means what? Sclerosis means degeneration, which means it is syphilitic, psychosyphilitic. So you have to go into the journey of the disease. What you have to probe here? Sclerosis means it is degeneration, no? Degeneration of the bones and hence degeneration of the nerves. So you have to, and eventually the muscles are getting affected by the nerves are not there. Then the muscles cannot obey. The muscles has to be obeyed only with the nerves, no? So the motor nerves are affected here, the motor nerves. So function, where you could not function well. Muscles are for functioning. Muscles are for doing jobs, for jumping, for doing your day-to-day jobs. Where you are not able to, or why you are not able to, or where are you getting that hindrance to perform your duties? Where did you fail? Where you could not express yourself or do the job? And what is the devaluation conflict? Why did your bones get devalued here? Why did the vertebra get devalued? Where did you not able to stand tall? Yeah, your spine is for you to stand tall with courage, with positivity, Where were you ditched down, or where were you pulled down? Where did you bend? Where did you broke? This is the question. So you have to touch the sensitivity point of the patient, and the patient will pour in with symptoms, match that with the journey of the disease, layer by layer, mayasam by mayasam, then beautifully you can form into a totality, and there you can pick up the syphilitic rubrics. What has to be treated in this case? The degeneration of the bones has to be treated. And so our medicine should be a muscular remedy as well as a bone remedy, and a nerve remedy, just like plumbermet, It can affect the muscles, it can affect the nerves, it can affect the bones also, or aurum or zincum met, or theridion. No, similarly, I am not asking you to jump into some medicines, but then you have to work out the case properly. It can be sometimes Naxomica also. So according to the, and then you say, okay, Naxomica is soric, no? Don't get prejudiced at all. What is this personality sitting in front of you is the only question. So you can unlearn everything and you can take the case proper. That is the art. You just have to properly you go, JOD, everything you go, and then you will know what is this person when he was born, what is this person when in his childhood days, and how has he evolved, what are all the hostile things which he had to face, and now what is this creature now with an ALS? He is all pessimistic and whatever. The patient need not be pessimistic, but then what all things he has underwent, the defense mechanism has failed him. He is not able to put up. And finally, now he is having all these degenerations. He has come to this level. So pick up the rubrics. What are all his deep thought processes? Pick up them. And then you will get few remedies. Out of that, you have to pick up according to the, preferably according to the sphere of action. You have to catch hold of a bone, nerve, and muscle remedy in connection. So Kyle is asking for thyroid, what has to be probed? Yeah, according to the thyroid, whether it is a goiter, then you don't have to probe much. You just have to look into the collection. Why is this colloid getting collected? You were asking about typhoid, right? Kyle, not thyroid. Okay. Typhoid, yeah. What is that? Typhoid can be psoric, psychotic, or syphilitic. Yeah. Thank you, Sai Narendra. So typhoid is only an inflammation. No, it starts as a sora, inflammation of the gastrointestinal, of course, anger. What were the anger conflicts for you? And if the anger was subsided soon, with 2 days time or with 1 day time, just like any other fever cases, you can tackle the typhoid. Whereas if it is little psychotic, if it is hidden inside, even if it is a small child, it may take 4 or 5 or 6 days for the temperature to come down unless the child opens up what has affected her from the school. I had a case and I cured that with acid force finally. It was not getting controlled at all. Usually for typhoid, we need only 24 to 48 hours to recover. Whereas this child was not responding at all, and a low grade fever. And the child is slow, child is very, very tired and not getting up and not eating, and it's kind of indifferent and always sleeping. And I gave her acid force finally. There was some disappointed love. That is, one of her friends had left the school and gone to some other school, and some scolding with the teachers. All these things combined together, I gave acid force and then recovered her. This child was making a statement: will I ever recover from this disease? Will I ever go to school? Will I ever live? Will I die? This was the question asked by this child of 5th standard, 10-year-old child. So that is the psychotic gastroenteritis, and syphilitic gastroenteritis will be where there is so much of violent anger and your body also reacts violently. How? By throwing up, violent vomiting, projectile vomiting with the element of blood in that, and shreds of mucus also passed in the through the anal region. That is dysentery coming up, violent dysentery with lot of mucus and blood in that. So, and lot of spasms also in the intestine. That will be the syphilitic typhoid. So anger is the question here. Anything else, guys? So can we call it a day? And we shall meet next Thursday.
Ma'am, one more question is.
Yes, tell me.
No, in the chat box about the gray hair.
layer of the gray hair.
Aishwarya, okay. What is the layer of gray hair? Yeah, interesting. Gray hair means what? The hormone. What is the hormone? Melanocyte stimulating hormone. The pigment melanin. Melanin pigment is not developed there. Or the hair roots are unable to suck in the melanin pigment. So melanin pigment, so it can be considered as the third layer or the fifth layer. Melanocyte stimulating hormone. Generally, it can be considered as a vitiligo. Vitiligo we consider as the fifth layer. That is the melanin pigment is not aptly produced by the melanocyte stimulating hormone. That is the same thing that has to be applied for the graying of the hair also for young persons. Premature gray only, not the old age gray. The old age gray is part of aging process, and that also is now more and more, no? If it is a premature graying for an adult, you can always try out this. Why did the hormone not work for you? All the hormones are for love, no? So you can always probe for love there. In vitiligo, what will be probe? What was the sudden brutal separation? That is the question. Somebody has been snatched away from you. What is that? So maybe from the head also, no? From some position has been snatched away from you. The leadership thing, the child was not given the leadership, somebody else were given the leadership in the school, or this child was nominated for the school leader candidate, and this child got failed, and that can cause the premature graying in a child. Or maybe the father or the mother of the family is taking care of the sibling, not me. I am left out. The mother is not taking care of me properly. Some conflict with the higher authority, higher superior person, even our own parents. All these things can be probed off there. Some snatching away, some love not given, etc. can be the reasons. So the layer is the fifth layer, Aishwarya. Okay, guys. Are we good to go now? Are we good to close the wind up today?
Yes,
Yes.
ma'am.
Okay, ma'am.
Okay.
Okay,
See.
ma'am. Thank you.